name is Chelsea. I'm going to be your nurse today. I have come in, I have some supplies to start a nasogastric tube on you. Is that okay with you?
Yes.
And then can you please just verify your name and date of birth for me?
Mark Smith, January 1st, 1993.
All right, let me just double check that here. Yep, looks like it matches up. Thank you, Mr. Smith. And so what I'm going to do is I'm going to take the flexible tube and it's going to go into your nostril and down past your throat and into your stomach, and that is going to help to administer some feedings for you since you're having trouble swallowing food. Is that okay?
Yes.
Okay, so I have my supplies here. I have some tissues for you if you need. I'm going to be using a towel just in case so we don't make a mess. I have some water for you to drink since you are not NPO and can swallow some water. I have my lubricant, my tongue blade, my pen light, my tape, my pulse ox, and my water too. All right, so I'm just gonna put some gloves on over here. And I already checked in your chart, but I'm just gonna double check for the physician orders, and it looks like that it is ordered to be done right now, and it doesn't look like you have any hindrance for the procedure, so it looks like we're good to go there. I'm just going to set you up here, if that's okay, Mr. Smith. I'll move you up a little bit too. And do you have any allergies, Mr. Smith?
No.
Okay, so first what I'm going to do is I'm just going to place this towel across your chest. And it will probably be a little uncomfortable, but it should not be painful. But if you do feel like you need to throw up, I have this basin here for you. And then I do just want to check here for your cough and gag reflex. And you already told me your name and date of birth. And can you just tell me where you are at today, Mr. Smith?
The hospital.
Okay, and do you know what day today is?
It is July 18th.
Perfect. All right, and then can you just say for me? Gag. Okay, looks good. And can you cough for me? Okay. All right, looks good. And then I'm just going to check both nares here to see if there's any hindrance, any deviated septum. And it looks like both are okay, so I'm just going to insert it into the right nostril here. Okay, so before I start inserting, I do want to get my supplies ready here. I'm just going to get a piece of tape so I can secure it quickly afterwards. And a piece of tape for the cheek. And then I'm going to measure to see how far I need to insert it. So what I'm going to do here is take the tip of the tube, the tip of your nose to your earlobe down to your xiphoid process. All right. So I'm about 43 centimeters. So I want to add 10 to that. So I'm going to go to 53 centimeters, and I'm going to mark that, which I'm going to do with this piece of tape here. Okay. That way I know where to stop. Okay. And then I'm going to leave this unclamped for right now in case there's any air coming out, but I will clamp it shortly after. And then I'm going to apply a pulse ox on your finger here. I just want to check your vital signs. Keep an eye on your oxygen levels. They look good. All right, I'm going to apply some lubricant onto the tube here, and I'm going to hand you this cup of water. So when I let you know, I want you to take some sips of water and keep sipping as I tell you. So first I'm just going to have you look straight. I'm going to have you take a deep breath as I insert it, and then I will instruct you what to do as we go, okay?
Okay.
All right, you ready? 1, 2, 3. All right, now I'm going to have you take a deep breath and then put your chin down to your chest here as I keep inserting. And then you're going to be drinking water. Keep sipping, And then about 25 centimeters, I'm checking the end here to make sure there's no air coming out. Looks good, it's not in the lung. I'm not seeing any coiling in the mouth, so I'm going to keep inserting. And then since this mannequin does not insert all the way, we're going to, actually I might keep going. Say that that's the full way. Okay, so once it's inserted, I want to secure it. And I also would want to clamp it, especially if any gastric contents are coming out. So I have that clamped off now. First what I'm going to do, I'm actually just going to tape this to your cheek right here. I'm going to make sure I'm not putting any pressure on your nose. And then I'm going to take my tape here. I'm going to secure it across. Oops. And it does not stick to the mannequins well, but we will, for the purposes of checkoff, continue and say that it is secured well. I'm also going to take it and tape it to the gown. Before I hook this tube up to any tube feeding or suction, I want to make sure that for our facilities policy that we're checking to make sure it's in the correct place. So our policy is to check by chest x-ray. So they are going to come up and do a portable chest x-ray on you before I get this hooked up, and then we'll get your feedings going after that, okay?
Okay.
Are you feeling okay?
Yes.
Okay. I just want to check in the back of your throat, make sure there's no coiling. Nope, it looks good. Okay, and then do you need some tissues? We'll clean you up here. Would you like to brush your teeth, or are you feeling okay?
I'm okay.
Okay. And then, let's see here. I want to make sure I clean up my supplies here. And then also, as I was inserting, I want to be rotating it 180 degrees as I insert for the ease of going down. I'm going to remove the towel here. And my supplies. All right, Mr. Smith, so we're gonna get that chest x-ray. Your vitals are still looking good, so I'm gonna take that pulse ox off of you. And I'm going to get you back in a comfortable position, but I cannot lay you flat. I'll keep you at least at 30 degrees. And then you said you don't need to brush your teeth or anything, right?
Right.
Okay. So I got all your personal items here. I got you all set back up. And then they'll come take that x-ray. I have it all clamped here. And then I will be back, okay?
Okay.
All right. Take my supplies. Some hand sanitizer. It does look like that it is not in the correct position, unfortunately, so we do have to remove that NG. Also, when I went out there, I did chart on there. I charted what size of NG I put in, and I charted the length of insertion. And so we will have to put it back in, unfortunately. I do have to remove it right now, but I'll give you a little break in between. And I also documented how you tolerated it and which nair that it was in and all of that. So is it okay if I remove it, Mr. Smith?
Yeah.
Okay. So can you just verify your name and date of birth again for me?
Mark Smith, January 1st, 1993.
All right, thank you. And then I did verify the orders. It does say to remove it because it is not in the correct position where we want it. So what I'm going to do is I'm going to move you back up here. And I'm going to place this towel back on your chest. So it's pretty simple and quick to come out. I'm just going to remove all the tape here. And then what I'm going to do is I'm going to, on the count of 3, have you take a deep breath, and then I'm just going to smoothly pull it out, okay?
Okay.
All right, so I want to kink the end of the tubing so no gastric contents keep coming out. And it was not hooked up to any suction or tube feeding, so it's already clamped here, so I'm good to go there. And on the count of 3, can you take a deep breath? 1, 2, 3. I'm just going to coil it in my hand as I pull it out. Okay, it looks like it's intact there. And I'm just going to wrap it up in the towel. And then I will dispose of that. Here are some more tissues for you. Looks like it got you a little runny nose. Do you need any mouth care?
No.
All right. And then I do want to keep you sitting up a little bit, at least over 30 degrees. So I'm going to keep your head of your bed up a little bit. And I have your personal items here. Is there anything else that you need?
No.
All right, I have your call light here. Make sure that you hit that red button if you need me. I have your wheels locked. I have your side rails up. I have the bed at lowest position and your call light is there again. And your personal items are within reach. And I will be back in a little bit. I'll give you a little bit of a break and then we will put that NG back in, okay?
Okay.
All right, thank you.